Hi, everybody. This is our Partners in Parkinson's meeting for October 2020, and we are so glad for you to be viewing this. My name is Shannon Condon. I'm a speech pathologist certified in LSVT Loud and specialize in the treatment of people with Parkinson's. And my partner with me.
Hi, everybody. My name's Gina Berger, and I'm a physical therapist, and I am as well certified in the LSVT Big Parkinson's treatment. I really enjoy working with people with Parkinson's. It's been a specialty of mine for pretty close to 10 years now. So we're super thankful to have you guys watch this and learn. And we're really excited tonight to have a guest speaker to talk about medication management with Parkinson's, which we all know is always at the forefront of your mind. And as therapists, Shannon and I field a lot of questions about medications, and we do our best. But tonight, we're very excited to have an expert more so in that field with us. And we'd like to welcome Meagan Manger. She is a pharmacist with Schwieterman's Pharmacy. And a little bit about Meagan is she was born and raised in New Bremen, and she graduated from New Bremen High School. So she's a hometown girl. We love taking care of our hometown patients. I know I do for sure. Meagan graduated from Ohio Northern and majored in pharmacy. She graduated in 2019 with a doctorate of pharmacy degree. And she also worked as an intern at Schwieterman's Pharmacy while she was going through college, which I think is pretty neat now that she's behind the counter dosing out drugs. I think that's a pretty cool road that you've traveled down, and I know that Schwieterman's appreciates that. She also had a big life event last year in September. She got married to her high school sweetheart, Parker, and they currently live in New Bremen. She enjoys interacting with her patients, but also enjoys outdoor activities, shopping, and spending time with friends and family. So thank you again, Meagan, for being here. She also worked a super long day today, and she said she's really busy during flu shot season. So I know Shannon and I, as are you all in the group, very thankful for her time.
Yes, thank you so much. And get your flu shots. This is our plug for your flu shots.
That's right.
So yeah, we're really glad. And so this is our format. We're just going to have like what would be a normal meeting where Meagan's going to present. Gina and I are going to ask some of the questions that you all have submitted from our group. And then this will be posted so that you can just check in on it anytime, or if you kind of forget something, you can always check back to it. All right, Meagan, if you're ready, I'm going to go ahead and switch to the PowerPoint.
Yep, that works for me.
All right, and if you want to request share to access, then I'll go ahead and give that to you. All right, it's all you.
Awesome. Well, thank you, ladies, for having me here. And for all of you watching, I appreciate it. And I hope you learned some things, and I'm sure you could teach me some things too from your experiences. But to get started today, I'll be again talking about the medications that are associated that you would typically see in Parkinson's disease. So to get started here. So there's a little bit of background that Gina shared with you. Again, Schwieterman's Pharmacy is where I work. We have 6 locations, and I kind of travel throughout those. So you can see me at New Bremen, Wapak, Coldwater, Minster, St. Mary's, and Salina all have locations. And then there's Parker and I, as Gina had mentioned, we got married last September. So some things we're going to go over today is just addressing the goals of treatment and discussing how these medications are used in Parkinson's disease, how they work, some key points. I have noted some cost in there, and then just some side effects to go over. There are a couple new medications that I have listed at the end that we can discuss as well. So goals of therapy for Parkinson's disease. These medications aren't necessarily a cure-all for Parkinson's disease. There's actually no medication that can definitely cure Parkinson's disease. These medications are used more to manage those and minimize the symptoms that you have. So in order to do that, these medications typically counteract the low dopamine levels in the brain. So Parkinson's disease, as we all know, is a decrease in dopamine in the brain. So we need to get that dopamine level back. And in order to do that, these drugs are aimed to replace that dopamine, to preserve that dopamine, or to imitate what dopamine does in the brain. So the first medication we're going to start off with is one that you all probably know about. It's carbidopa levodopa, which is the brand name that you might know about is Sinemet or Rytary. And this is typically the drug of choice in patients, especially with the movement issues. And this drug works by, so like we said, the dopamine in the brain is what we're trying to imitate. So levodopa is the precursor to dopamine. So dopamine can't get through the blood-brain barrier, which is the barrier between the brain and the rest of your body. So levodopa in the brain changes from the levodopa to the dopamine. And levodopa can get into that blood-brain barrier. So when you take the levodopa, it can cross that where dopamine couldn't cross that barrier. So that's one medication that's in this combination. The other medication is the carbidopa. So the carbidopa is used because when levodopa is broken down in the body, levodopa only gets to the brain like 1% of that without using carbidopa. So carbidopa helps keep levodopa around to get to the brain. So there's more levodopa for the body or for the brain to use and make into dopamine. I hope that all makes sense. Is that clear, ladies? Okay. So another thing with Sinemet or carbidopa levodopa is that sometimes it only lasts for a certain period of time from the studies that were shown or from what people have said. This medication typically works for about 4 to 6 years. And with many years of therapy, you can notice wearing off symptoms. And what that means is that your symptoms might come back in a shorter amount of time. So if you were taking this medication, say 4 times a day, and it's supposed to last you 6 hours, you might notice this medication only lasting for about 2 to 4 hours instead. So that would be the wearing off symptoms that can occur when using this medication for multiple years. There are many formulations to this medication, and some of those are immediate release tablets and controlled release tablets. So these medication or the immediate release and controlled release tablets are typically what I see a lot of times in practice. And as you can see, the cost is pretty low for these. They're generic medications, so it's not brand name, so they are a little cheaper than some of the medications that we see in Parkinson's disease. Key points here are the controlled release tablets. They cannot be crushed or chewed. So the controlled release releases through the body through the body for a certain amount of time. It's just a controlled release rather than all at once. And then there's capsules, which this is known as Rytary. I see quite a few patients on this actually. It is more expensive though because it is brand name, but again, it does have that controlled timed release too. So this might be a good drug in a patient that has trouble swallowing, and that can happen in Parkinson's disease for sure. These capsules can be opened and sprinkled into applesauce and taken that way. So, and you wouldn't want to crush or chew those tablets or those capsules though. Just a couple other formulations. I don't see these often at all, but there's orally disintegrating tablets. That kind of tablet would sit on your tongue and dissolve, and then you wouldn't need any water. You would just swallow that. And then enteral suspension, this would be used, it would be infused directly into the stomach via a PEG tube or just a tube that's connected to the stomach. So I won't spend too long on those. I don't see those too often. I don't know if you ladies do, but a little bit.
Yeah, we had a patient advocate that came and spoke to our group. I don't know, Gina, has that been 2 years ago?
Yeah, it's been at least 2 years ago, maybe 3. And we actually did then have one of our group members that did get the Duopa, the pump that goes into the belly to just, provide that more constant absorption.
it was a great way for our group members to really see how it worked and hear how, kind of the troubleshooting of it. So yeah, it was, so yeah, we have seen a couple people.
Awesome. Okay. All right. So for dosing, this medication is typically titrated up or increased weekly with the doctor's supervision in order to limit any side effects that could happen, like nausea or vomiting, that sort of thing, any GI upset. And it's dosed multiple times throughout the day, typically 3 to 5, but I have written the initial dose there. Typically I see it 3 times a day to start, and it can increase in dosage and like amount of times per day you would take it to. So some side effects that are typically seen with carbidopa levodopa are what I consider dopamine side effects. So like I said earlier, it's when you have more, or we're trying to get more dopamine in the brain. So we might see more dopamine-like side effects. These side effects include nausea or vomiting, heartburn, constipation. You could also see a lot of drowsiness, confusion, or depression, or more psychological issues that might arise. And then we see a lot of orthostatic hypotension. And what this is a fluctuation of blood pressure as you go from a lying to standing position. Some people think that it's when you get really dizzy and almost feel like you black out when you stand up, that sort of thing. So if you notice that, you'd want to definitely drink more water, but definitely get up as in a slower, when you go from lying down to standing up. First sit up and then start standing up, just a little bit of a slower pace to help prevent you from blacking out or getting too dizzy. And then there's also movement fluctuations or dyskinesias, and this would be too much movement. So with levodopa, it's kind of on a pendulum. So you could have that where you have too little levodopa and your tremor isn't controlled, but on the other spectrum, you could have too much movement where you have too much and you're kind of jitter, or how did you explain it?
The dyskinesias, yeah.
So we want you to be right in the middle with that controlled symptom. So, all right, here's some key points for carbidopa levodopa. There are dietary considerations, and a lot of you might think of the high protein diet. You'd want to avoid too high of a protein diet because this decreases the effectiveness and absorption of levodopa. So when you take the medication, once it gets out of your stomach, it goes into your small intestine, and that's where levodopa is taken up into your blood to get to your brain. So in order for the levodopa to get into that small intestine and absorbed, it could compete with the protein to get to the right spot to be absorbed. So that's why there is that the high protein diet that you would want to avoid while taking this. And then also while taking, or you can take this medication with food to decrease any stomach or gut upset. And you don't have to take it with food, but if you do have an upset stomach, I would recommend like some crackers or something like that, just small protein diet, just to help any upset that you might have. And then we talked about timing earlier. The tablets you'd want to space evenly throughout the waking hours to avoid your motor symptoms. And then with this medication, how we titrate it up slowly or increase that dose up slowly. If your doctor stops this medication, or you decide to stop taking this medication, you definitely want to let a doctor know, because we don't want this medication just to stop abruptly on a day. You'd want to lower that dose down, and that would be tapered down too. That would avoid any big side effects. There's many side effects like confusion and blood pressure fluctuations that we want to avoid when stopping this medication. So on to another class of medications. These are dopamine promoters. So medications that are used to help promote that dopamine from being diminished in the body. So the first one is catechol O-methyltransferase inhibitors, and we'll refer to those as COMT inhibitors or COMT inhibitors. Medications in this class include entacapone or tolcapone. And these medications, these medications work because levodopa and dopamine are broken down by the enzyme COMT. So these COMT inhibitors inhibit that enzyme, which inhibits the breakdown of the levodopa and dopamine in the brain. And these are used most effectively in combination with levodopa, carbidopa, especially the entacapone. That definitely needs to be used as an add-on therapy to that levodopa, carbidopa. And this would be used when you start to see those wearing off effects, like I talked about before, after so many years of being on this medication, when you notice those wearing off effects. So there's the brand names. The one that I typically see is the entacapone or Compton. It is a little more expensive, and like I said, it must be used in combination, and it is in tablet form. There's also a combination pill with all three medications, the carbidopa, levodopa, and entacapone, and that's expensive as well, but you'd want to use this if you're pretty stable on a certain dose, because it would be hard to tweak those individual doses of the medications. So that's what I typically see with that. So side effects of the COMT inhibitors, we would decrease your dose of the carbidopa first, because it can cause some diarrhea or stomach or gut upset, like I talked about before, because you're enhancing that carbidopa and levodopa. And you might see some increase in liver enzymes with the tolcapone, but that's something your doctor would monitor and blood test. And then other than that, you would see similar side effects as carbidopa and levodopa, and you can refer to that slide that I did go over with the dopamine-like side effects. And then again, with this one, you wouldn't want to stop taking this abruptly. Okay, on to another class of medications. These are monoamine oxidase B inhibitors. And that monoamine oxidase B is another enzyme that breaks down dopamine. So these medications inhibit that enzyme and don't allow that breakdown again. So there's three medications in this class: selegiline, rasalogine, and sulfonamide. I think I said that right. All right, so selegiline, this has three different forms of formulations. Comes in capsules and tablets. The orally disintegrating one that that melts on your tongue, essentially. And then MSAM, I don't have that listed because that's a patch, and I typically see that more in psychological issue kind of thing, not necessarily used in Parkinson's disease. So selegiline is kind of particular with how it's dosed. It's dosed twice a day. And if you're on this medication, I'd recommend taking it in the morning and after lunch, not necessarily like every 12 hours, because this medication can keep you up at night. And then the rasalogine or Azilect, this one is definitely brand name that I've seen, and it's dosed once daily and doesn't matter on the timing. So you can see that it's a little bit more expensive there because of the brand name. And then the sulfonamide or Xadago, that one is also brand name tablet, and it must be used as an add-on therapy to the carbidopa, levodopa, and you'd want to take it at the same time every day. The side effects are pretty similar to carbidopa, levodopa, except this one has a little bit more. I noticed a lot more fluctuation in blood pressure, whether that be high or low. This medication can cause some falls and also those dyskinesias. And then it does have quite a few drug-drug interactions. So you'd want to check with your doctor or pharmacist to make sure that what you're taking doesn't have any particular drug-drug interactions. Or just let your doctor know everything that you're taking so they can make that decision for you too, the best decision. And then one more as a in this kind of class, it's Simitril or amantadine. It works by preserving the dopamine by blocking its return to the presynaptic neurons, which ultimately increases the release of dopamine. It's usually used as an initial therapy for rigidity or slow movement dyskinesias that are induced from levodopa. This medication has a pretty good response, or a 50% response, which is pretty good, that I think at least, but it is kind of short-lived. So it has a short-lived benefit. So in these medications, if you are noticing a good response and then start to know or start to see a decrease in that response, you'd want to let your doctor know so you don't have to take something that's not working for you. Some side effects with this one is drowsiness, depression, dizziness, ankle swelling, and it's dosed based on your kidney function. So your doctor will look at that too. I have a big price range here. I think that's just dependent on what type of medication, whether capsule or tablet. So there's that one. So on to the next one. These are dopamine imitators. So they're going to look like dopamine in the brain. They basically mock the role, kind of like a substitute teacher. They're not the real teacher. They're acting as the teacher. So if you can see it as like a substitute. And these medications act on the dopamine receptors. So the same receptors that dopamine works on, these medications work on those as too. And like I said, they're not as effective as dopamine itself, but they will help manage your symptoms. And then these medications can be used as initial therapy or used as add-on therapy. So here's a list of those dopamine agonists. Mirapex, you'll want to take this one with food to avoid any stomach upset. And you'll see this 1 to 3 times dosed a day. Requip or ropinirole, you would want to take this one also to avoid stomach upset. And the dosing for this is 1 to 3 times a day as well. These medications are also used for restless leg syndrome, if you've heard of that. And then Neupro is a patch formulation. This medication, you'd want to rotate the application sites. You wouldn't want to use the same spot within 14 days. So you'd want to take note of that, and you change this patch daily. This patch has aluminum in it. So you'd want to know that if you would go to the hospital and need an MRI or any testing done, you'd want to let your doctor know that. So that is those. Side effects, like I said, you'd want to take with food and to avoid the stomach upset. And we'd want to titrate this up again, just like we would with the carbidopa-levodopa. You might see some hallucinations with these medications as well, but other than that, it would just be the dopamine side effects like carbidopa-levodopa. All right, apomorphine or apokine is typically used in advanced disease. And that's typically due to the side effect profile and then the injection, so how it's used. So it's used as an injection under the skin, and it's used as needed for like those off periods that you see between your levodopa doses or when that's wearing off and that sort of thing. The side effects can be severe. Some people see severe low blood pressure or loss of consciousness, severe nausea and vomiting, drowsiness, irregular heartbeat. And this medication typically only works for about an hour after you inject it. And it is pretty pricey too. So those are the reasons why it's typically used in more advanced Parkinson's disease. All right, here's some other agents for you guys that I found as I was researching. They're newer agents, so I don't know too much about them, but I wanted to share this information with you as you might see these agents being used more in the future. So actually, not yet. We're going to talk about anticholinergic medications, and then we'll get to the ones that are newer. So anticholinergic medications are used to help manage the tremor in younger patients. And the medications that I typically see in this medication class are the benztropine or cogentin and the trihexyphenidyl or Artine. And they are generic medications, so they are pretty cheap. They're mainly used in younger patients because of the side effect profile. It can cause dry mouth, constipation, urinary retention. So urinary retention is when you can't use the restroom, blurred vision, drowsiness, and confusion. Okay, now on to newer agents. All right, the first one, I don't know if I can pronounce it, but I said this earlier when I was practicing. We'll let you look at it and then you can decide how you want to say it. But this medication is a tablet formulation that's used to manage those off symptoms as well. It's when those symptoms return between the medication doses, and it basically boosts the signaling of the dopamine in the brain. It's used once a day and can be added to the carbidopa-levodopa. And the side effects are the dyskinesias, dizziness, and constipation. Those are just the side effect profile for now. This came out in August of 2019. And again, I haven't seen it used at all, and why I've been a pharmacist, and it actually came out since I graduated school. So I haven't heard too much about it, but it could definitely be something we see in the future. So, and then the Imbria, this is a levodopa oral inhalation. This was approved in December of 2018. I have a picture there. It is an inhaler, and it's also used in those off episodes in patients being treated with carbidopa levodopa. This one may be used up to 5 times daily as needed. And then, so this inhaler is used, it has 2 capsules in there. The typical dose is both of those capsules together, so 84. So you'd put 1 capsule in, you'd puncture the capsule in the inhaler by, I think, clicking it down, and you'd hear a click, and then it would be primed and ready to go. And then you'd inhale that, and then you would do that again with the second capsule. So you do that twice for 1 dose. And then, since it is an inhaler, you might see side effects like a cough or chest discomfort. But other than that, since it does have that levodopa, you'd see similar side effects as your carbidopa levodopa. So that is what I found there. And then now is where I'll take some questions from you guys.
Okay.
I have to unmute myself. Yeah. Well, thank you so much. I definitely recognize a lot of the names of those medications. I work in home health, so actually one of my jobs when we don't have a nurse involved is I actually have to enter in all of the medications and kind of do this reconciliation. So I've learned a lot since being in home health, but it was really helpful for me to learn just a little bit more about it. It'll help me explain it better to my patients and families. And I'm sure they learned a lot here too, just from the information that you presented. So a couple of the questions that we have from our group that Shane and I entertain a lot and that we got sent in, you've touched on a little bit, but I was wondering to kind of go back to that very first medication, the levodopa carbidopa. Sometimes we will see patients referred for therapy and they tell us, I'm holding off on starting any Parkinson's medication, right? I don't want to start the Sinemet because I know it only lasts for so long. I'm going to hold off. So that was like a big school of thought for a long time. And then now there's physicians more who are like, no, start the Sinemet, take it right away. So I don't know, like your experience as a pharmacist, if you have any input on that, like what trend do you notice? Do you notice people starting it right away, or do you think a lot of people still wait?
I think it kind of depends on their symptoms and if they can manage it themselves, if it inhibits their daily living or how they feel about their daily living, then I would say definitely, or if they can live with it, to wait. That's kind of how I was taught in school. Actually, they said if they can manage symptoms and they're willing to wait, that's fine. If not, I've definitely seen it started right away as well. So I think it's still a controversial topic, but I do remember one of my professors saying if their motor symptoms if they can handle those and kind of do manage those on their own, or just don't feel like they have to stay at home all the time just to get by, then they can wait a little bit. But other than that, I've seen a lot of people start it too right away. So
yeah, I agree with that exact answer that you say. I still see it both ways, and I understand it kind of both ways as far as you have to be able to move and live and function, because the start of everybody's demise is when you don't move. Mm-hmm. So that's why I think, therapy is referred a lot for that as a management kind of tool. So, okay. Well, that was
very nervous, people waiting too long, because we see that decline in function, which kind of doubles and quadruples on itself, because you start losing your balance, or start with that stiffness, then maybe you stop moving as much, or something becomes more difficult, or you fall and break a bone. And so we just see it as it's very panicky for us as therapists. So that's just an interesting and definitely a controversial topic. I would agree.
Right. Yeah. And then you also talked, I was curious, Megan, if you could talk a little bit more, because we have like sometimes patients, they become like obsessed with this like eating schedule because they're like, well, I can't eat protein like an hour before, an hour after, and I got to take my meds at this time. And it becomes this whole like thing. And like one guy I know, he lost like 45 pounds. And I'm like, where's the rest of you? He's like, and it was this whole, so I don't know, like as a pharmacist, like, would it be okay if they ate it with protein every once in a while, or what's like the bottom line on that?
Yeah. So what I find is that, well, again, the hour, it's usually, you can take it 30 minutes prior to a meal or 1 to 2 hours after a meal is typically what I was taught. So then you wouldn't really have too many interactions there. I read 2 grams, or what did I say? I had it on another slide, but having a little bit of protein isn't going to hurt you with this. But again, you don't want a big steak every meal, that sort of thing. So just kind of limiting it. And again, you probably, if you're that steak and potatoes kind of guy every meal, you might lose some weight by trying it, by limiting that protein. But you can have some protein, but definitely the 30 minutes before and 1 to 2 hours after, you shouldn't have any issues with that then either. But
right. And that again just helps, just to review what you had said about that, like it helps your medication work optimally.
Yes.
Because again, Megan was saying that the protein actually blocks your body's ability to absorb that dopamine, that Parkinson's medication. So that's why to space those out. So,
and it's what Gina and I say to the group all the time is you have to stay on a schedule with your medicine. Your medication schedule becomes paramount. So at the beginning of the day, you look at that schedule, and if you're having dinner at a steakhouse, then you need to decide what time you're eating dinner based on your medication schedule. You really don't want to move your medication versus that. And we're all for living your life, but you need to do it within the framework of that structure. Has always been kind of our one of our biggest things.
Yeah. Right. Yeah. And that's for sure. So Megan, if you ever have a Parkinson's patient or family member saying, this medicine doesn't work, it doesn't help me, like my first question is do you take it on time and right. routinely as prescribed? Because we really find that when people make that a priority, they're like, oh yeah, like I can move better and I feel better. Yeah. So it is very important for everybody to, I know it's hard to kind of be very rigid with that, but with Parkinson's, it's extraordinarily important that you take it as prescribed and routinely, by those hours. Mm-hmm. I have another kind of question, and then I might let Shannon ask some questions, maybe. We'll see. I just, as a physical therapist, obviously I work a lot on transfers and, things like this. And a lot of times, and I was really glad that you brought this up, Megan, but the orthostatic hypotension, so that feeling of dizziness or lightheadedness when you stand up or change positions, that is like a real deal, and not something just to talk about. I feel like it happens probably with more people than not. So, it seems to happen as a result of just their disease, but then also, like you said, sometimes it's a side effect of the medication. So, what suggestions as a pharmacist would you have if, a patient was coming to you saying, I get so dizzy, every time I stand, like what can they best do to manage that?
Yeah. So what I typically tell patients is just, again, make sure you get up slowly. And I'm sure you go over that with them as well. But the other things are water and salt intake. We want to increase that intake of the salt in the water, because that gives you more substance in your body. And then just small meals throughout the day, I notice it seems to help a lot of people too, just to kind of give more substance in the body as well. And then I do like to tell people to take blood pressure on their own too. With Parkinson's disease, blood pressure can fluctuate a lot, both high and low. So just taking your blood pressure every day in the morning can help, and keeping a record of that too, I think is important. So.
Right. Oh yeah. I actually, that reminds me when you brought up the small meals, that does remind me. So when our body digests a meal, that actually can cause some people to like have a bout of low blood pressure too. I work with a gentleman who I have to like plan my therapy around his meals because he gets this really lightheaded episode as he's digesting his food. So maybe if other patients out there or people who are listening notice that it's timed around like after a meal, it might be due to some of that digestion. So taking Meagan's advice and maybe making that meal a little smaller could help that symptoms too. So thanks.
No problem.
Definitely. All right. So I have a really great question from Joe. He asked what your thoughts are about taking Ritalin for daytime sleepiness, specifically caused by nocturia, but I think a lot of our patients have daytime sleepiness for a lot of issues. But he also wants to know, is there any help for nocturia? And for those people listening that maybe aren't familiar with that word, that's when you get up a lot in the night to go to the bathroom. You have to urinate frequently during the night, which means you're not falling into a deep sleep, which means you're not getting good quality sleep.
Yeah, so very good question. I actually looked into this quite a bit. They're treating a side effect to another drug. I don't like giving you a medication. It's called polypharmacy, and I try to, in my practice of pharmacy, I try to see if that's happening and try to help prevent that. But Ritalin in particular with Parkinson's disease could be a potential drug-drug interaction. Some medications like the MAO inhibitors, you wouldn't want to take with a stimulant like Ritalin at all. So, and it could, the stimulant of Ritalin could potentially cause more motor disturbances or more tremors and that sort of thing for you. Let's see what else. And then it could affect your heart rate or other heart issues as well if you have that underlying. So Ritalin with daytime sleepiness wouldn't be my first thing to go to. It would probably be to treat the cause of the nocturia first, or the getting up multiple times throughout the night. And that's the same for anything. If you're getting up at night or have a disruptful sleep from sleep apnea, or like you said, getting up to go to the bathroom, or just not being able to sleep well because of anxiety or other issues, Ritalin wouldn't be necessarily the first thing that I'd go to, I guess, but you'd want to definitely talk to your doctor or pharmacist to see if there's any medications that you could take at different times, or if that's what's causing you to use the restroom. So one thing I think of with people getting up at night to use the restroom is diuretics, or what's known as water pills. So your hydrochlorothiazide or furosemide like Lasix, those medications you'd want to take earlier in the day. I typically say in the morning or before 4 o'clock in the evening, to kind of help prevent that. So I would rather treat the problem rather than that. But there is a medication like ditropan or oxybutynin that would be used for an overactive bladder, but that would definitely be something that you'd want to talk with your doctor about first to see if there's anything else you could try first before just trying a medication. So.
Okay, that was great. Thank you so much. I think that will be really helpful because I know that that's pretty frequent for a lot of people. Also frequent for a lot of people as a speech therapist, there are kind of two separate oral afflictions that happen to people with Parkinson's. They either have drooling and seems like an excess of saliva, or often because they're having a slowness of swallowing, or a really dry mouth, and which is causing dental problems and difficulty speaking and doing all kinds of things. So can you kind of discuss any medications or any things that might be contributing to those issues, and anything that either over the counter or behind the counter that might help ease that.
Yeah, so like you said, the salivating, when I was learning about Parkinson's disease, I saw that the salivating came more like even with the disease in itself. And then, as we mentioned, some of those dopamine agonist, let's go back to the end here.
Oh, sorry.
Oh, did I get to
your control? Dopamine agonist.
Yes, dopamine agonist, and then the anticholinergics. Oh. Those actually cause a dry mouth too. So medications can cause those, and then I think it was on my last one of my closer to the last slides, possibly. Yeah, my other agent. The next one, I think.
The next one.
Yes, so dry mouth I have listed as a side effect for these anticholinergics. So like I said earlier, you don't want to treat like the salivation with a drug if you don't have to, but if you're a good candidate for anticholinergic, one of these medications might be good just to help your tremor and to help the salivation. Mm-hmm. For the dry mouth, I a lot of times just offer, like, we have dry mouth lozenges at the pharmacy that I a lot of times offer. There is like a spray or something that you can use as like artificial saliva too that you can use for dry mouth.
Like a Biotine or a Magic mouthwash.
Yeah, exactly. So that's typically what I see a lot of times for dry mouth, at least. But
okay, great. And then our last thing is we really love the Schwieterman's pill pack service. And it's because, like we said, it's really important for patients with Parkinson's to take their meds routinely and on time. Can you explain how the pill pack service can help people with Parkinson's accomplish that?
Yeah, so like Gina and Shannon both mentioned, adherence is key, and taking them on time at the right times throughout the day is great. And Schwieterman's offers a pill pack, so that's medication that we pack. It comes in a week's worth of pack, and some stores are different. We have some stores that do 1 week at a time, 2 weeks at a time. A lot of our stores do a whole month at a time, but you would get 4 packs then for a month. And in those packs, you have each day of the week, and then you have 4 times. So it would be breakfast, lunch, supper, and bedtime. But you could kind of, as long as you take them at those right times, you could kind of manipulate the timing of those. But so you have 4 slots throughout the day that you can put those medications in. And you can sit down and discuss with the pharmacist when you typically take those, and discuss when the right time would be, because some people don't know exactly what time to take, say, a cholesterol medication and when would be best. And then with Parkinson's meds, we can also go through when is the best time that you take these, and when do you take these typically. So yeah, you would go through the pharmacist, sit down with them, go through when you typically take them. We typically have these patients on our Med Sync program too. So that's getting all those medications that you take filled at one time for you of the month. And then we would put those into your pack. Typically our packs range, I think, maybe like $4 to $5 a week. I'm not 100% sure on that cost. I'd have to look at the paperwork, but all of our stores do those. Like I mentioned earlier, we have 6 locations. So if you're interested in that, that's something we'd definitely be willing to help you with. So
great. I think it's a really convenient service, and it allows people who aren't maybe don't have someone to kind of help them sort through, because even I, it's difficult to, like, okay, I have to sit down every 2 weeks or a week and like put all these pills out. And it can be confusing. And if you miss 1 or 2, so I think it's a great service, and we appreciate it.
I think putting your pills in any sort of pack helps you remember, 1, to take them, and 2, did I take these today or not? So you're not taking too many too. So
we put our dog's medicine in a reminder, because otherwise, like, did you give it? Did I give it? Who gave the pills?
Yes, yes, that's a definite answer then.
All right. Gina, do you have any other questions?
I don't think so. Thank you so much. This was really great for all of us. And again, this is like one of the topics that Shannon and I get field questions about the most. So we're
Yes.
so thankful to have the expertise of a pharmacist to kind of help clear things up for us and answer our questions.
And
Yeah.
if we were live, this was different time and we were in person, you would draw a very big crowd because people love to come and see the pharmacist. So when we can all get together again, we would really love for you to come to meet our group in person.
Yes,
Yeah.
I gladly would. And if anybody has any questions, whether that be asking Shannon or Gina or giving the pharmacy a call, where you would be happy to answer them anytime, not just tonight. So definitely ask your questions. We'd love to answer them and see you.
Great. Great. All
Great.
right. Well, I am gonna let us all end our day now. So thanks again so much. And thanks, Gina, for your time as always. All right.
All right. Thanks, Megan. And thanks, Schwieterman Pharmacy. Thank you so
Thank
much.
you so much. Bye-bye.
Bye.
Sorry. I'm out last minute. Did he get in the way?